Good evening, friends, and a warm welcome to season 3.0 of 4D, that is Detailed Discussion and Dialogue in Diabetes, in Indian Diabetes. If it's season 3.0, the number 3 should have an extra added edge. And that is true. Allow us to welcome very warmly 3 wonderful doctors, 3 wonderful speakers, 3 wonderful human beings from the city of Indore, the heart of India. A warm welcome to Dr. Puneet Goyal, cardiologist at MGM Medical College in Indore, Madhya Pradesh. Warm welcome, Dr. Puneet. We also welcome Dr. Shivshankar Sharma from Ganpati Clinic in Indore. He's a nephrologist who works in transplantation as well. Warm welcome, Dr. Sharma.
Hello, sir.
Hello, sir.
And
Thank you.
welcome, Dr. Puneet. And then the third of the trio, an equally warm welcome to Dr. Siddharth Rakhe, who works at Vishesh Jupiter Hospital and at Evolution, the endocrine clinic in Indore. Warm welcome, Dr. Siddharth. So let's talk about the power of 3 today. We'll talk about 3 aspects of medical care, 3 aspects of health, which we sometimes ignore when we are managing diabetes or obesity or any kind of cardiometabolic disease. We do remember the major pillars, the 3 pillars, the 4 pillars of treatment. But what about the other things around the pillar? A pillar alone is not going to create a house or a home. The pillars are there to give you structure. So let's say you build a building, you have pillars, but then what makes that building a home? What makes it a happy place? That's the people who live in it. That's the affection that comes when you interact with each other, isn't it? So let's talk about these aspects of metabolic care, of diabetes care. Dr. Puneet, we work in Indore, all 3 of you. How far away is Ujjain from Indore?
So it's around 40-50 kilometers, just 1 hour run.
Yeah. And we have people logged in from across India, people greeting you from each and every state. What is Ujjain famous for?
Mahakal Mandir name.
It's famous for
Recently-
spirituality. Yeah. Yes. Carry on.
Recently, they have developed one more area around Mahakal Mandir, that is Mahakal Loop. So they have further extended that area, and especially people come for visiting this mandir only from across the India as well as from out of India.
That's nice, and it's good to know about all parts of our great country. And in 4D, when we meet doctors from across the country, we learn this as well. That's an added benefit of joining 4D every Friday evening. Dr. Sharma, many years ago, something like 15, 16 centuries ago, lived a sage in Ujjain. His name was Bhartrhari, and he's known as, yes. Would you like to speak about him? What contribution did he have to Sanskrit literature, to Sanskrit language?
Sir,
Yes.
I have heard you once talk about Gita.
Yes.
So I remember your lecture at Bhopal, and it was really a very erudite kind of a thing. I never thought that a doctor would talk about Gita and practice. So I really enjoyed it. Avantika Nagari, Ujjain, Ujjayani.
Yes.
So Ujjaini
Right.
is one of the oldest cities of not only India, world. And it is famous for so many things. Bhartrhari की गुफाएं जो वहाँ पर हैं, जहाँ पर actually Bhagwan Krishna, Lord Krishna took his education there. And there is also Kark Rekha. So Kark Rekha पर स्थित एक मंदिर है वहाँ पर. Ujjain is a beautiful place. It has got such a beautiful history associated with it. The Vikram Vetal story that you read, जो बचपन में हम पढ़ते आ रहे हैं, that happened in Ujjain. And जो जिस मंदिर में हुई थी, वो मंदिर भी वहीं पर है, जहाँ पर वो वेताल का सर काटता है and all that. So it's a very interesting place, sir.
Thank you for enlightening us, Dr. Shiv. Dr. Siddharth, when we hear things like these, Dr. Puneet, Dr. Shiv Shankar speaking in such a pleasant manner, the English word be euphonious, like you have euglycemia, so euphonia, in such a euphonious manner about Ujjain, what kind of hormones wake up? So let's say we go to a doctor, we go to a clinic, and the doctor speaks to us the way Dr. Puneet and Dr. Shiv Shankar are talking to us. What kind of hormones will get stimulated in the patient's circulation?
Sir, I mean, in a relaxing environment, I would say that parasympathetic system would be more active. As far as the hormones go, the typical anti-inflammatory hormones probably should rise. I mean, in brain, the level of serotonin should go up. The hormones with inflammatory properties like cortisol or any norepinephrine should go down. I think, sir, we are still, years behind to find that happiness hormone. Maybe in future we'll find that.
And probably there will be multiple, not one but many.
Yes.
So basically, the happy hormones go up when you listen to happy conversation, when you are part of that, and the harmful hormones, they come down. The pro-inflammatory cytokines come down. Why Ujjain is important? Because that is where Bhartrhari lived. He was a sage. He contributed to Sanskrit grammar, and what he said very famously, long before people said this in Greek or Latin or in English, like Shakespeare, what he said was that every word, every phrase, every sentence has a weight. It has a meaning. So whenever you are in conversation with someone, whenever you use a word, a phrase, or a sentence, it carries a weight. It's not tangible, it is intangible, but still it is a weight. And let's talk therefore about the importance of language first of all. In today's 4D, it's season 3.0, we'll talk about three hidden aspects of managing metabolic disease. And the first is language. So Dr. Puneet, when a person comes to you with, let us say, acute coronary syndrome, unstable angina, chest pain, the patient doesn't know what he or she is going through. But the patient is afraid. Apart from all the other things that you do, so maybe you would want to do a cardiovascular first aid, which might be an isosorbide monotitrate, it might be an aspirin, it might be a statin, it might be wheeling the patient directly into the cath lab. That is a separate matter. But what about language? Can you give vocabulary first aid? Can you give linguistic first aid? So would you like to share any examples from your OPD? Some maybe you did the right thing, you did the wrong thing, and how can our language work as a therapy for a patient who has come to the cardiology OPD?
I think certainly language is very important whenever a patient comes to us, and it is important for us to talk to him in a very simple language and not to make him frightened about whatever problem he has. So whenever I go for rounds or in the ICU or anywhere or even in emergency, I initially ask them, आप कैसे हैं? Are you okay? आप ठीक हैं? So आप कैसे हैं अभी? ये पूछना उनके लिए बहुत जरूरी है. If we ask such questions, then they'll feel relieved that a doctor is concerned about us, how we are doing right now and how we were earlier. So asking about their well-being is important. Then I try to understand their symptoms, that how significant they are, since how long they are, and how they are doing. So asking about their wellness is important, I think.
So that's nice. Thank you, Dr. Puneet. So first of all, an overarching question, how are you doing? Which means we are putting you at the center of our universe. And you is the person living with disease. So how are you doing? That conveys to the patient that yes, you are the center of gravity for me as of now. Everything that I can do for you, it's all focused on you. And after this overarching question, then you go into details and maybe you ask about the cardiovascular system and then about other systems as well. So Dr. Sharma, now in cardiology, we have more of acute patients. And of course, we do have acute kidney injury, but chronic kidney disease, is there a kind of something called dialysis distress or CKD distress, a sense of hopelessness in patients who have been condemned to have a chronic kidney disease? And then we don't have things like, stenting in chronic kidney disease. The renal replacement therapy is a bit more challenging. So what are the challenges that you face in terms of language, and how do you convert that into happy language?
Sir, I think of the 4 people here, I am the one who has got, I think, the most, you can say, tough deal and tough way of dealing with patients sometimes, because these 2 are my friends and I've listened to you. You have got such a sweet tongue. So, sir, obviously, मेरा एक मित्र था, वो बोलता था कि किडनी की बीमारी तो कलयुग की बीमारियां हैं, यहाँ कहाँ सीता का काम. That's why sitagliptin is not that useful in CKD and linagliptin is more useful. So कलयुग में सीता का क्या काम. So anyway, sir, yes, most of the patients that we come across are already in distress because of so many things. The fear of dialysis is something that we come across. Today only I saw a patient of Dr. Puneet, and the patient was a doctor's mother. But even then, the doctor was very afraid of dialysis. So there is a fear and stigma of both CKD as well as dialysis and transplant. And it is very difficult to deal with such patients. And most of the patients, to get them into that particular mindset where they're willing to listen to you, when you can imbibe some hope in them, it is very difficult. But yes, in most cases it is manageable. We in most of the patients, what I say is कि किडनी की बीमारी इकलौती बीमारी है जो विकल्पों की बीमारी है. It is the only disease with multiple options. Everyone has two. You can give one to your loved one, and that person will be perfectly fine. The another line that I use is from Brenner's and Rector's Kidney, in which it is written that no one dies with kidney disease, everyone dies with kidney disease. मैं उनको ये बताता हूँ कि किडनी की बीमारी से किसी की मृत्यु नहीं होती, किडनी खराब होती है तो डायलिसिस करके ठीक किया जा सकता है. Most of the times it works, sometimes it doesn't, it takes time, but yes, at the end of the day, patient has to get treated. Gradually they come to understand that this disease is manageable easily.
This is very reassuring for us, actually, Dr. Shiv. Thank you so much, because what you are telling us is that even in a supposedly bleak situation where the patient has got CKD stage 5 and stage renal disease, even then we can create optimism and we can tell them that yes, you can cure this disease, you just have to move into action. So instead of going into valuing in depression, you ask them to move to optimistic action. So thank you for that. And I'm sure Dr. Puneet and Dr. Siddharth and all of us who are listening will agree that it is toughest from a psychological perspective to handle a CKD stage 5 patient. Handling acute kidney injury, handling acute coronary syndrome is tough. Certainly it is tough. Motivating a patient to go into the cath lab for a stent is tough. But CKD stage 5 counseling is really, really tough. We agree with that. Yeah, there also I would like to say, let's just remember Bhartrhari. He says that every word, every phrase, every sentence is important. So the way you choose your words, what you say first. So you might want to say, Madam, don't worry at all. But then why should you not worry if there is cardiac disease or kidney disease? But you say, Madam, don't worry at all. We can take care of your husband. Of course, all you need to do is to fix up the potassium, and you need to get a kidney, and you need to go for a couple of dialysis. But Madam, we'll be able to take care of your patient. So begin with the positive, end with the positive, and like a sandwich approach, you can squeeze in the reality right in the middle.
Definitely, sir. I'll follow it.
Yes. Dr. Siddharth, how does it work in the diabetes clinic? How easy, how difficult is it to motivate a person living with diabetes to accept insulin in a timely manner?
Sir, see, in my opinion, trying to treat a patient is like trying to score a run on a pitch. You know, on one end there is one batsman, on the other end there is another batsman, and until two are on sync, run won't get scored. And one of the thing my unit in charge used to do, that he used to, as you said, every line has weight. He used to remember ki bhai, this patient is from say Tamil Nadu background, or this patient from Marathi background, and he just used to learn one phrase of every language, ki epidirke or ela naru, and that sort of used to work as an icebreaker. That one line is helpful in forming the connection, and once you have the connection, once you have shown your real interest that bhai, my intention is to provide you with the scientific whatever scientific evidence I have to improve your health, patient also can understand ki bhai, we can trust this particular doctor, and whatever he is advising is still depending upon the geographical area where you are practicing. It is very difficult to counsel the patient ki bhai, we need to start the insulin. And usually my approach is, whenever I see a patient for the first time, I lay down the option that there are 3-4 options for the treatment of the diabetes. Insulin is one of them, and unlike what people might have told you or what you might have heard, it is a very good option. Although at this point of time we do not require to start insulin, but just so that you know that in all the type of diabetes, there comes a time when you need to start the insulin. So this is for a patient who doesn't require insulin. For a patient who require insulin, I think the best approach is telling him or her clearly कि भाई if I ask my medical science, अगर मैं विज्ञान से पूछूं कि भाई इस मरीज के लिए मैं सबसे अच्छा क्या कर सकता हूँ, तो विज्ञान मुझे बताएगा कि भाई इस मरीज को इंसुलिन के लिए प्रेरित करें. एंड व्हेन यू एक्सप्लेन इट इन अ वेरी सिंपल लैंग्वेज, not in 100% of the patient, but most of the patient will understand, going from a good, kaise ho in their own language to making them understand the physiology of the diabetes in a very short and lucid manner, and to lay down the option and to finally explain कि भाई in this particular situation this is the best foot forward for both of us. I think that may work in most of the situations.
Thank you again. Good messages that we are getting. We are talking today about various aspects of therapy that are not included in the pharmacological pillars. And our first aspect is language. We've taken inspiration from Ujjain, from Bhartrhari, and we see now that all our speakers, Dr. Puneet, Dr. Shiv Shankar, Dr. Siddharth, all are actually using the power of words, the power of phrases and sentences to create a conversation, a salutogenic conversation, a happy conversation, which leads to happy outcomes. Dr. Siddharth has mentioned that you tell the truth and you tell it in a very relaxed manner. Don't also give the illusion of democracy. So you might say, yes, there are multiple options, but then this is what science is, this is what the book says. So you give that illusion of democracy, but then you make sure it's like a guided democracy. Dr. Puneet, now what we see is that all of us have challenges. I am a physician. I have a different challenge convincing the patient to get a platelet transplantation, to get a platelet transfusion in dengue fever. I have an even bigger challenge convincing a patient not to go for blood transfusion or platelet transfusion in dengue fever. So that is a bigger challenge that we face. Other challenges that we face would be obesity, referring to cardiology, referring for renal replacement therapy, and of course taking insulin or anti-obesity medication. So all the challenges are the same. Would you like to share any one tip from cardiology with our physician colleagues? How can we help improve the timely acceptance of cardiac interventions? What is it that we can do in our OPD to help you help our patients better?
In my personal opinion, it is important to have a good communication skills with the patient as well as their attendants, because their belief in us is very, very important. If they believe in you, they will always understand what you are telling them, and they'll get it done. So what is more important is to give time to the patient. A lot of times we see that some consultants that come, they see patient for a minute or two and then they go out. In such a scenario, when you give very least time to the patient, they will never get connected to you. So it is important to give time to them, listen to them. What is more important for a doctor is to become a good listener. A lot of times when you listen them quietly, they'll be able to tell you the exact symptoms. Then you examine them very well. But for every patient, when I go for my rounds, I examine them from head to toe every time. I'll check their pulse, I'll check their distal pulses, I'll auscultate their chest, I'll auscultate their heart. So they'll understand that this doctor is seeing me, he's giving me time, is listening me, and he's examining me. Then he's seeing the ECG, he's seeing the blood reports, he's seeing the urine output, he's seeing how the blood sugar is going on, whether he's requiring insulin or not, did he have fever, did he have his morning breakfast. So when you see patient as a whole, giving him enough time, then they get connected to you. And then when you tell them, yes, you need an angiography, there is some problem with ECG, and it will give us an idea what should be done further. You just need a medical treatment, or you may require something. So even sometimes patients are afraid of just doing an angiography also done. So I tell them angiography is a simple test. It's just an X-ray of you. It is nothing more than that, and it will give us an idea if we can manage it medically. It is not necessary that when I do an angiogram, some blockage will always come. A lot of times, no blockage comes or minimal blockage comes, and we just manage it with medicine. So it will give us an idea how to proceed further. So when I explain them in this manner, then they agree easily. So it is important to have a good communication skills both with the patient as well as with their attendants.
The explanation, yes. Dr. Sharma, would you like to carry on? What is it that we can do to help you help patients with CKD get their treatment in a timely manner? This week I had a patient who has been a patient of mine for the past 20 years. creatinine is at 9. He has been advised a fistula 3 to 6 months ago, I think 6 months ago, and he has still not even got the fistula made. What to talk of the next steps? I think the only thing he's done, which the nephrologist advised, was to get the hepatitis B vaccine. Beyond that, he has not got anything extra. What can we do to help our patients?
Sir, just like at the Siddharth and me are shared rooms next to each other, and it always happened that he used to prescribe SGLT2 inhibitors to his patients on day 1, and I used to say he prescribe it on day 3, on third visit. The same goes for me. I expect from not expect, but maybe it will be great if the diabetologist starts talking about the complications, the possible complications, once the patient's confidence develops into him. For example, if you're a diabetic patient is coming to you on first visit, he is only both of you are just getting to know each other. In Siddharth's language, the two are on practice pitch and trial balls are being played, and you are not running actually for runs. And once that time arrives when he starts developing a confidence in you, then you should start telling him gradually what are the possible complications. And if you inculcate the idea that kidneys may get affected in long term, the peripheral neuropathy, the cardiac complications are possible. Similarly, insulin is possibly required. And if you infuse it gradually, that idea, then when such situation arises, the patient will not feel cheated, or patient will not feel that, oh Bhagwan, मैंने ऐसा क्या कर दिया कि मेरे साथ ऐसा हो गया. And in that case, when he goes to the doctor, he is already aware that this complication was possible, has happened, and it is manageable. So if that message is conveyed long back, then it leads to a different kind of result with nephrologist. That is the only thing that I can think of right now.
So the key word is a gradual explanation and timely explanation. It would also be worthwhile to talk about how we communicate the concept of complications. Now, in general, all of us are attuned to pathology, pathophysiology, so we tend to speak of complications. Dr. Siddharth will tell us about the ominous octet. So that's fine, but why use the word ominous? Even before you begin, you've already decided that you're going to fail. The ominous octet, coined by DeFronzo, can very easily be recoined. Had it been Bhartrhari, he would have said the octet of opportunities. I have 8 opportunities, not 1, but 8. I have 8 opportunities to help you in improving your glucose. If one doesn't work, I always have the 2nd, the 3rd, the 8th. That's what Mahakal means. Large. So, similarly, let us say we found someone to have a high UACR, or maybe to have a high HSCRP or lipid profile. The term that we would like to say is, yes, see, we have this opportunity. We've got your astrology chart, but we can fix it. So let me fix it. Let me do the following things for you. This is an opportunity. We can prevent worsening. We can prevent worsening of complications or onset of complications. And then let's do better. I can do this much for you, but let's refer you to the nephrologist or to the cardiologist or maybe the pulmonologist, and they will also do a better job. So let's get a double kind of security layer. So if we were to use these words, positive, salutogenic, proactive, and then if you are able to make your patients friends with the nephrologist at maybe CKD stage 3B, they also become friends. And when CKD 5 is about to come, it will come sooner or later, then the patient agrees, earlier. Otherwise, you go on visit 1, let's say your eGFR is 8, and you go to the nephrologist on visit 1. As it is, you are so depressed, and then the nephrologist gives you a long list of things to do. You just don't feel like listening to him. But had you been with him for the past 1 to 2 years, then you would understand that yes, he or she is trying to take care of you. So, Dr. Siddharth, we have got opinions from Dr. Puneet and Dr. Shiv Shankar. What about our conversation? We are talking of conversation with the patient. What about conversation between doctors, between physicians, endocrinologists, alternative care providers? How can we make our conversation more healthy and more health-oriented?
I think the crux of it would be to find the opportunity to find a solution. Whether it is a conversation between a endocrinologist and a nephrologist, or endocrinologist and a cardiologist. The idea should be that this is the situation, these are the problems, and these are the solutions, or these could be the solutions. If we discuss a solution from a multiple different perspective, the chances of missing something would go less, and chances of having a good product outcome would go up. Sir, I have one input in the previous thing that sir said about the kidney part. Sir, when a patient comes to us with a diabetes, first thing I ask is कि भाई आप शुगर क्यों कंट्रोल करना चाहते हो? Because sir, the area where I practice is not very, education level is not much. Most of the patient are from very rural background, and they just know कि मेरा ये खाली पेट का शुगर 300 है. अभी इसको क्यों कंट्रोल करना है? They have no understanding of that. I mean, we discuss DCCT and UKPDS, but to provide that knowledge in a very small, easily understandable way, just by asking the patient कि भाई आप शुगर क्यों कंट्रोल करना चाहते हैं, and the patient says कि वो तो बढ़ी हुई आई है तो कंट्रोल तो करना ही है. If we can make a patient understand at the first contact कि भाई ये तो अभी तो तुमको इतना, आपको सिर्फ ये यूरिन शायद ज़्यादा जाना पड़ रहा है, बट इफ़ यू स्पेंड मोर टाइम विथ hyperglycemia, these are the 3-4 organs which might get affected. The data suggests that after 6-7 years, this much percentage of people may end up with some organ disease. So if the first contact, the patient can be made to understand that these are the things which I have to watch out for. If push comes to the shove and you find yourself in a position that after 6 months the patient is developing diabetic kidney disease, then probability of that patient being in a more receptible, accepting the situation that yes, I know this could have happened, is more. So I think that first contact with the doctor should be very informative.
This is honestly, Dr. Siddharth, something new for me, but I think it is a wonderful idea. And that is the beauty of 4D. We learn from each other. So I am going to begin practicing this from tomorrow. Why do you want to control your diabetes? Why do you want to control your blood pressure? Once we are able to get the answer, and the answer is yes, I want to live a healthy life, a happy life, a long life. I want to dance at my grandson's wedding. Once you're able to get that, or maybe the person might say, yes, control my glucose for me so that I can eat anything I want, so that I can go to Chappan Dukan or Sarafa Bazaar. We'll just find out what these places are. So, I mean, that sets the tone for the rest of the consultation. But let's summarize this first super pillar of diabetes care, metabolic care. Apart from the pharmacological pillars, our pillar is language. Your language should be realistic. You cannot tell a lie. But it should also be relaxed. You make the patient feel relaxed and comfortable with you. Don't make the patient feel uncomfortable or afraid. So a relaxed, realistic conversation, a reassuring conversation. Find optimism in everything. Even if the creatinine is 9, the potassium is 9, there must be something positive in it. Maybe the positive thing is that the sodium is normal. So you tell that, see, your sodium is normal, your hemoglobin is normal, even your ESR is only 23. Okay, potassium is 5, that's a separate matter. We have medicines for that. So relaxed, realistic, and reassuring. If you are able to do that, your patient will automatically come in a receptive mode. Our complaint as physicians is patients are not receptive to us. They'll become receptive if you follow these 3 R's. They will return to you for the next consultation, and you will be able to retain them. If you have to refer to the nephrologist, cardiologist, endocrinologist every now and then, that actually helps in retention, provided we speak the same language and it is a pro-patient language. But Dr. Puneet, we just spoke about Chappan Dukan, and the next pillar that we'd like to talk about is lifestyle. So would you like to talk about the lifestyle of Indore in particular, Madhya Pradesh in general, and India at large?
As far as Indore is concerned, it is one of the food capital, we can say, for India. Here people like to eat, like to go to restaurants. Chappan Dukani, as you said, Sarafa Bazaar, as you said. So here maybe a food restaurant will work more and a clinic will work less. You'll see less patients at clinics and more people eating around here and there. So obviously people here like to eat a lot, like to go to restaurants late in the night. So slightly different kind of culture. It is Indore is famous for different types, different tastes of food, of course. So a little bit different lifestyle, but yes, whenever I see a patient, I generally try to understand what lifestyle they are following, because there are a lot of issues related to lifestyles, like working in the night shifts or not having enough sleep and not doing any physical activity to keep themselves okay. So I just tell them, you have, and everyone have 24 hours in one day. So why can't you give just 1 hour to yourself, and remaining 23 hours you do other things? You have a sleep of 7 to 8 hours. You just give 1 hour for your own health, and then remaining time you can give to your family and in your work. But at least try to extract at least 1 hour for yourself. So this is how I try to make them convinced that they need to sleep well, they need to reduce work stress, they need to follow a normal working pattern rather than working at night, work at day. I just tell them कि ईश्वर ने दिन काम करने के लिए बनाया, रात सोने के लिए बनाई है. So you work on that pattern only. Don't try to work in opposite manner, and just be physically active. Why just you want to keep on sitting? If they have a job like engineering job where they keep on sitting on in front of laptop, why don't you take a break after maybe half an hour, 1 hour, for 5 minutes, and then again go to your work if you cannot change your job. So this how I try to convince them that in addition to their work, they have to give time to themselves also, so that they can do their work better.
So for those of us from the rest of the country, Chappan means 56. So Chappan Dukan is 56 shops. That is a famous food street of Indore, and people come from across the country to taste Indori food. That's one part of lifestyle. Dr. Shivshankar, warm greetings to you. We have logged in Dr. Saurabh Sharma, a nephrologist from Safdarjung. He says Indore is known for Sattvic lifestyle. Is this true or not? Is it debatable? And when we use the word lifestyle, there are multiple things. So Dr. Puneet has spoken about nutrition, food. That's one part of lifestyle. Another pillar is our mind style. Now in English, normally we use the word mindset. I personally dislike this word because it means that things are set in stone. If Dr. Siddharth thinks that I'm a very, grumpy, grouchy kind of a senior, that's his mindset. He'll never be able to change it. But suppose we change the word and we make it mind style. Now style suddenly means very fluid, very relaxed, dynamic. Bratahari would be proud of us. And then if Dr. Siddharth has this mind style, he might be able to change, and he might be able to say, yes, on a good day, maybe on a Tuesday, Dr. Sanjay is not so bad. And on Fridays, though, he's awesome, because like today is Friday, Friday is our 4D day. So Dr. Shivshankar, mind style of people living in Indore and Madhya Pradesh and India. Is it Sattvic? What does the word Sattvic mean to you? How does this impact our health?
Sir, definitely not Sattvic in my opinion. Sir, first of all, I would like to listen to your Bhartrhari quote. You've been talking about it, and I am really curious about it. What did Bhartrhari say? Because is it Shabda Brahma hai, or is it something else?
Yes. So he said that every word has got a weight, and through words, actually, you can practice yoga or you can meditate. So if you use the right words, you can actually change your mind style. And this is what he said in Sanskrit. Today we use the word neuro-linguistic programming. So let's look at it this way. Let's have a patient with metabolic disease. The patient comes to us. The patient is not very happy with life. His or her glucose are all over the place. The heart is not doing well. The kidneys are about to conk off. We tell them, if you intervene, if you take the right action right now, we will be able to protect your heart and kidney. So we say this, but the patient has to convert that into action. It usually doesn't work. And this is part of Indic philosophy. If your thoughts, your words, and your actions are concordant with each other, you are in harmony. Now the patient is in disharmony. We want to help. So we begin with words. So that's the power of language. With the words, we try to change the patient's mind style. And once you have done that, then you can actually change the patient's actions. This is neuro-linguistic programming. Now, in Indic philosophy, it is also said you try to take charge of your thoughts. Like the Bhagavad Gita will say, you try to, you don't have to capture them, but you just have to tame, T-A-M-E, tame. You have to tame your thoughts. At the same time, the Gita says that thoughts are very slippery eel to catch. It's very difficult to take care of your thoughts. They're very naughty. The Hindi word is chanchal. they are very mischievous. I think mischievous would be the right word for Chanchal. So instead of focusing on thoughts, let's focus on our words. If you speak in a euphonious manner with the patient gets into a euthymic state. That means good mood. So we use our words to change our thoughts, that's mind style. And once this happens, then it is relatively easy to change the actions. And the actions are those which are geared towards health. So this is what he said. This is what we practice. It just so happens that when someone teaches us in Latin or Greek, we take it as the gospel truth. When someone teaches us in simple English or in simple Malayalam or Tamil, then we do not take it as the gospel truth. That is an unfortunate part of our training.
But gospel by definition. Sorry.
Yep. Sorry. Carry on, Dr. Sharma. Carry on.
No. Gospel by definition means good story, and you are a good storyteller, sir. So your word is sounding like a gospel. And as you said, mansa vacha karmana, and that's what
Yes.
one in the ideas, one in the thoughts, and one in the action. So it's.
And what NLP says and what Bhartrhari says, that instead of beginning with the mind, you just begin with the vach or with the speech. That is what we have more power over. So make sure that your own speech is optimistic. Tell your patient also to follow optimistic speech. I can control my diabetes. I shall take care of my heart. I will keep my kidneys healthy. So if you do that, then automatically things fall in place. But let's come back, Dr. Siddharth, to this concept of Satvikta. So again, a close friend of yours, a senior, Dr. Sandeep Julka, an endocrinologist from Indore, he says that Indore is a dopaminergic city. India is a dopaminergic country or an adrenergic country. Is this right? Is this wrong? And what impact does this have on our metabolic health?
Sir has rightly said. Sir, first of all, let me clarify. Kalra sir's statement, Gumpy Grouchy should not be used in the same sentence. So for all of the listeners. Sir rightly said that Indore and now the whole of India is becoming a dopaminergic city. And sir, by definition, I mean, if we were to define a sattvic city or sattvic food, I think which doesn't exert too much pressure on your body. Your body is meant to do certain things. Your kidneys are meant to excrete certain amount of salt. Your body is supposed to manage certain amount of food or certain amount of calories. So sattvic, by a very broad general definition, would be a food which doesn't exert your body, any part of the body. And as I said, the Indore is becoming a dopaminergic city. One little story, when I shifted to Indore, there was a little food shop around the corner of the hospital I joined initially. And when I joined, he was also, at the same time he started off. And within 6 months, I was still sitting in the OPD and he was busy as anything. So,
I told you.
So as I said, Indore, food based, these things are very flourishing. And I don't know whether it is good or bad, but gradually whole of the India whole of the world is shifting toward this dopaminergic mindset, that immediate gratification, forget about what will happen next. So I think that is about.
And these kind of things in lifestyle, they actually impact our cardiac health, our renal health as well, and of course overall metabolic health. And if we are able to remain balanced, if we are able to follow a healthy lifestyle, we'll actually be able to improve our health. So Dr. Puneet, any one do and any one don't that you would like to share with our listeners today? We are all physicians listening to you. So anything from the lifestyle perspective. We have spoken at length about language. Our second L for today is lifestyle. Anything that you'd like to convey to us and through us to the patients? Healthy lifestyle for healthy heart. Dr. Shiv, perhaps we could take over. Any do, any don't, a healthy lifestyle for healthy kidneys.
Sir, when I start talking to my patients about these things, this usually I do on second or third visit so that they don't get too disturbed or disconcerted on the first or second visit only. But then I give them an audio recording of all the do's and don'ts that I expect In that audio recording, I asked them to ask as many questions as they want, whatever questions they want, so that they can listen to it. They can make their loved ones listen to it. The lady who's preparing their food also should listen to it. And I include every single possible thing that I can imagine, and I make it sound funny so that it's not a burden to them. Later on, it is definitely a burden, because controlling salt, controlling water, these are the most difficult things for any human being. When you ask someone कि आपको पानी कम पीना है, you can't ask, मतलब आप व्यक्ति से बस आप उसकी जान ही नहीं मांग रहे हो. पानी छोड़ना और इंदौर के व्यक्ति से नमक कम करने का बोलना, it's equally bad, it's equally difficult. So on third visit I tell them कि अचार, सेव, नमकीन, मिक्सचर, पूड़ी, पापड़ी, भजिए, कचौरी, समोसे, दही बड़े, आलू बड़े, बाफले, बाटी, पराठे, अंडा, मांस, मटन, मच्छी बंद करना है. So and फिर आम, केला, चीकू, लीची, सीताफल, संतरा, मौसम्बी, तरबूज, खरबूज, अनार, अंगूर, नारियल पानी, फलों के रस इत्यादि बंद करना है for low potassium. काजू, किशमिश, बादाम, खजूर. So it's a huge list. I have to memorize it like a waiter would in a hotel. And so there are so many lifestyle factors that are imperative when we are dealing with renal dysfunction patients. I have seen patients go into cardiac arrest after eating one arm. So a person who was reasonably well controlled. So it's common, and the lifestyle changes are required. It's very difficult to convey them in a nice manner, because at the end of the day, the patient has to make those changes in his life. And उस समय सुनकर अच्छा लगे, लेकिन घर जाकर तो करने में दिक्कत तो आती ही है. So it is a difficult thing. I'll say that, sir.
So we just keep on repeating, do it in a relaxed manner, and just explain to them. But it's also important to tell them the things that they can eat. And also it would be a good idea,
Yes, sir.
to tell them how to cook. So this problem I faced in practice maybe about 2 decades ago. And I saw that when I would tell, whether they followed the advice or not is separate matter. But if I would tell them to restrict sugar or restrict ghee, they wouldn't mind. The moment I would say stop salt, restrict salt, the lady of the house, she would look at me as if, I've sort of murdered. And it was happening with 1 or 2 ethnic communities in my state. It wasn't happening with the others. It took me a long time to figure out that these were ethnic communities where the lady knew only one way to her husband's heart, and that was cooking. She knew only one way of cooking, which her mother had taught her, and that was full of ghee and salt and spice. Now I was taking everything away from that lady, and suddenly she felt as if she is, irrelevant. She'll be kicked out of her home because she'll not be able to cook food anymore. Then I realized that it's important to talk about again in positive. So, of course, we will say, so my list, Dr. Shiv Shankar, is much shorter. That means that is no Nimbu and no Nariyal. That is the hyperkalemia list that we have. If people ask for more things, then I refer to Dr. Dinesh Dhanda, who's the nephrologist next door. So the third thing we tell you. But we do tell them what are the things that you can eat. So we tell them, yes, you can eat everything in life, madam. You can eat this, that. You can drink as much milk as you want. Yeah. So now, as much milk, I know whom to say to and whom not to. As much milk, if I know that the person is not going to afford or is not going to digest more than 200 ml of milk a day, then I say, madam, you can take as much milk as you want. But on the other hand, if the person comes from a family where they are already drinking 1.5 liters of milk a day, then I don't say that. So you do that. You also tell them how to cook. So, ma'am, we understand that you are used to putting lots of ghee on your chapati. It's going to take time. While cooking, while kneading the dough, why don't you put some milk or some buttermilk or maybe some curd in your atta, in the flour, and that will make it much softer. You will not need any ghee on top. So you tell them the positive ways, what they can eat and how they can prepare it. So that's a very nice way, and thank you, Dr. Shiv, for making it easy for us. Again, if we all speak the same language, it helps our patients trust us more, and it helps all of us. Dr. Siddharth, what about exercise? So we are speaking of lifestyle. Dr. Puneet has talked about how to, try and resist the chapan dukan, the street food. Dr. Shiv Shankar has also given us analogies about ideas about food. But how do you encourage the average Indian citizen to move a little bit?
So, sir, taking forward from the Sattvic Bhojan, I think there is also something called as Sattvic lifestyle. Sir, I usually give example. There were few studies of, and I have a printout in my this thing clinic. There were few studies done in the southern Karnataka area, in which still the people who live in the jungle area, and they had GPS monitors, and they said the male used to walk around for 15-16 hours, the female used to walk around for 11 to 12 hours. So that is how our when our body was evolving on the earth, that is how we were supposed to live. And currently, if we calculate over the day, we will find that most of the patients don't even walk for 10 to 20 minutes. And making them understand that this body is meant to be used like this, and if you are not using it, then probably you will end up in some kind of trouble. And sir, my belief is a very difficult advice which patient is going to follow for 10 days. It's better to give advice, relatively easy advice, which a patient can follow for a relatively longer period of time. So I start with the minimal 150 minutes per week aerobic exercise, and I ask the patient that to attach that exercise with a daily work. कि भाई आपको सुबह दूध लेने जाना है, तो उसके साथ में आप अटैच करो कि डेली चल के उधर तक दूध लेने जाना है और लेके आना है. So the chances of you missing out on the next exercise are less. And once I have a patient who is following 150 minutes aerobic exercise per week, then gradually I add on other kind of exercise. And again, in a very simplistic manner, I ask कि भाई आपको strength training करना है, तो इधर जिम जाके लोहा उठाने की बजाय घर में आप नहाने से पहले 5 पुशअप से शुरू करो और उसको बढ़ाते बढ़ाते आप 30-40 पुशअप तक ले जाओ. उतना भी स्ट्रेंथ ट्रेनिंग हुआ तो एटलीस्ट सम बेनिफिट patient can derive out of it by giving minimal 60 to 80 seconds or 1 minute to that. So I think the trick would be to use this simplest of advice which patient can follow for a longer period of time.
In small increments, that's a good way. And also socially acceptable exercises. It is possible that maybe I live in a village, I am a lady. If I say I want to go to the gym, people will laugh. But then from Madhya Pradesh, my friend Dr. Navneet Agarwal, he works in Gwalior, he's a physician. He coined something called temple therapy. The same lady, if you tell her, madam, we are giving you the best medicine, but you see what happened, I had a dream, or I thought, if Dr. Sharma says it, then you get double emphasis actually on that. If you go to the temple, which is situated 1 kilometer away, or to the mosque, or to the Gurdwara Sahib, but you have to go on foot and make sure you wear good footwear. If you do that, if you go and pray once a day, this medicine is going to work better. So the patient does that. After 3 months, she is fine. But then after 6 months, she says, Doctor, earlier I was losing weight, now I'm not losing weight anymore. And then what Dr. Navneet and Dr. Shiv Shankar do is, then they say, yeah, madam, now you know God appeared again in my dream. And now God is saying, now you have to go to that temple or mosque, which is 2 kilometers away. So that way you kind of increase the intensity or duration of exercise, and this actually does work. So you find a socially appropriate exercise for the patient. We've spoken, Dr. Puneet, about language, we've spoken about lifestyle, and we have seen that we have the power of changing the way our patients behave, the way we behave also as well. There's a third L we'd like to discuss today, and that L is lumen, the intestinal lumen, the large intestine, and the lumen contains microbiome. It contains a lot of bacteria. In general, we feel that all bacteria are our enemies, but that's not true. So the microbiome, as a cardiologist, what does this mean to you? What is the current research going on in cardiology about happy bacteria, about friendly bacteria in the gut?
Sir, regarding microbiomes, I have limited experience, and I would like to learn more from you and Dr. Siddharth regarding all this, because right now I am not much aware about it. I read about it, that different type of food habits will change your microbiomes and can affect your future CV health and can change your risk factors. But I personally do not have, truly speaking, personally do not have much experience how to use it in my own clinical practice to change the food pattern of my patients and their relatives.
There is a question for you from Professor Jaideep Khare. He is an endocrinologist at Bhopal, and he asks, if we were to come to Indore, which is your favorite fermented food? What would you treat us to? in the chappan dukan?
I don't know, maybe a dhokla.
Okay, so dhokla is fine. So that's good. So that's nice. And suddenly this makes us feel hungry also for dhoklas. So dhokla is a fermented food. Dr. Shiv Shankar, any comments from a nephrology perspective? Fermented
About
foods, gut
Dokla?
microbiome, yeah, dhokla, and how are people with chronic kidney disease more prone to GI disturbance?
Sir, definitely. Sir, if we are talking about microbiota, it was a long question in our exams. Microbiome. We have been listening about it since ages now, and we are not yet sure how to exactly go around it. And regarding microbiomes, one of the most commonly prescribed medications by nephrologists for CKD patients are usually probiotics, pre-probiotics. I don't know how much they actually work because there is no evidence as such. But yes, we have been, most of us, if not me, but many of us have been using it since ages now. And regarding this fermented food, so usually for fermentation and for giving that spongy feeling, what the guys use is soda. And soda again is sodium. So when in my list of things, I usually ask them not to eat khaman dhokla as well. So Jaydev, yes, you can eat khaman dhokla as much as you want when you come, and I'll treat you to as much as you can. हम इंदौर में 4 चांद लगाने के लिए 2 चांद और इकट्ठे कर लेंगे. Jaydev has got a head just.
That's true.
But no, not for my kidney patients.
So things in moderation.
Yes.
The point here is that the lumen is also important. So when you're talking about the pharmacological pillars of cardiac or renal or metabolic treatment, do remember language, lifestyle, and the lumen. You have to keep the gut healthy, and each person will have different requirements. Somebody with a potassium of 6 and a creatinine of 4 will have totally different requirements from someone with hyponatremia. But Dr. Sharma, could you continue further? In summer especially, what havoc do GI diseases, like maybe diarrhea, traveler's diarrhea, what havoc do they play on the kidney, acute kidney injury, things that you have got stuck with? How can we help our patients take care of themselves? Preventive measures.
Sir, most of the times the problem is not the food, the problem is the water. And telling your patients to drink healthy, not only eating healthy, drinking healthy. Many of the patients, they suffer from diarrhea and they say that, okay, sir, we are using only RO water and still we are suffering from diarrhea. And then you come to know that, okay, they are using RO water everywhere, but they are not washing their utensils with RO water. They are using the normal water for that. So there are so many things that can and usually do go wrong as per Murphy's law. Regarding such situations, it is one of the most common reason why I get being called in ICU when a patient with AKI comes in summertime due to acute gastroenteritis, and all I do is usually prescribe fluid. And regarding my CKD patients, when I'm telling them what to avoid, I tell them street food has to be avoided, and I tell them this reason only, that कि यदि कोई दीवार कमजोर है तो उस पर एक हथौड़ी मारने पे भी दीवार पे नुकसान लंबा हो सकता है. So I tell them that you should avoid these foods so that you don't suffer from these traveler's diarrhea, gastroenteritis kind of things. So that's why pani patasha is a strict no. And that's why kachori is permitted sometimes, but chutney is not permitted ever, because chutney is culture media.
This is a paradox that we face. Dr. Siddharth, on one hand, the endocrinologist or physician will say you eat more of raw foods, like fruits and salads. And on the other hand, when you go to a wedding, an Indian wedding, or maybe to a party, and you go at dinner time, the salad that they have cut, that they would have done early morning, there's hardly any ambient temperature control. And at that time in the marriage, the healthiest food would be one that is boiled or even fried, because at least there are no bacteria in it. The raw fruits, the raw salads are actually, they're a storehouse of all those angry bacteria. So how do we navigate this? How do we convince our patients? How do we explain to our patients with diabetes how to take care of the
So this is unfortunately reality what you just said or mentioned ki bhai, most of the time when we talk about this salad, this is a storehouse for what we call as the bad bacteria. So the mere fact that most of the vegetarian used to depend upon the gut bacteria for the B12 suggests that we are supposed to live in sync with the gut bacteria. And we have ample data to suggest that in metabolically unhealthy patient, diabetic patient, the gut flora is different vis-a-vis a metabolically healthy patient. Now, whether it is a association or causation, that is a different thing. But sir, I mean, if we trace it logically, then it would be very difficult to explain that why change in bacteria is causing a patient becoming metabolically unhealthy or diabetic. More likely it is the food habits which is causing both the metabolic health and the gut health to go haywire. And to correct that food habits, ultimately we have to teach the patient कि भाई ये देखो इधर 100 में एक बारी नुकसान तो हो सकता है कुछ खाया तो many of our patients says कि भाई ककड़ी खाने से गला खराब होता है, इससे नाक खराब होती है. But ultimately we have to teach the patient कि भाई ऐसा 100 में एक आदमी को हो सकता है, but the benefit you are going to derive not only in terms of your metabolic health but also in terms of gut health, that if we can make a patient understand, that they would be more receptive to follow that particular path. And one more this thing, sir, in my state and currently the area where I'm practicing, the antibiotic abuse is very common. So I always tell my patient कि भाई ये देखो कम से कम रसायन शरीर में डालना इज द बेस्ट फुट फॉरवर्ड, बहुत जरूरी है, तभी अपन दवाई लें, दर्द का दवाई और जो भी एंटीबायोटिक्स हैं, अगर आपको लगता है कि भाई बहुत ज़्यादा आवश्यकता है तभी लें. एंड इन अंडर एक्सपर्ट गाइडेंस, वो जो ओवर द OTC पे जाके and they can purchase a linezolid and tablet linezolid. So that is the second point which I teach my patient when I am particularly focused about कि भाई ये तो patient देखो पेट दर्द आके बोलता है, इसका gut microbe के ऊपर थोड़ा ध्यान देना चाहिए. So among the things which I teach, one कि भाई एक तो आपको fiber diet salad बढ़ाना ही बढ़ाना है, and avoid unnecessary use of any kind of medicines which is not strictly necessary. It is provided by a healthcare professional.
Antibiotics and also the proton pump inhibitors, which are, if you look at gut guardianship, so very clearly our books, the prescribing information says not more than 8 weeks, unless you have Zollinger-Ellison syndrome. And our prescriptions, we are all guilty. The PPI will continue. If you are in practice for 25 years, the PPI is also going on for 25 years. But let's talk about the gut and let's try to summarize what Dr. Siddharth said. There are paradoxes as well. So the first is the gut bacteria themselves. It would be a surprise for many of us to know that serotonin, we know that serotonin is a happy hormone. We write serotonin uptake inhibitors in depression. But 90% of the serotonin of the body comes from the gut, not from the brain. It is our bacteria which makes serotonin. So if you have a happy gut, happy bacteria, you yourself will be happy. Earlier, when patients would tell me, I have gas in my stomach and it goes to my brain, I would immediately say, this is psychosomatic. You don't know what's going on. But now I say, yes, madam, thank you so much for helping me diagnose. It's actually your bacteria which are sending signals to the brain that they are unhappy. So let's take care of those bacteria. At the end of that, you still might give an alprazolam or a clonazepam. That is a separate matter. But you have acknowledged and you have appreciated your patient's symptoms. The patient comes to you and says, I've got a growling stomach. Whether you give a satronidazole, metronidazole, or you tell your patient to wait for 24 hours, that is the second part. The first step is, thank you for coming. Your stomach told you that something is wrong. Let me help you. Maybe with yogurt, maybe with curd rice. Let's help you out. Thank you for listening to your stomach. So that is about the bacteria. The second part is the probiotics or prebiotics that we can use. There is mixed evidence regarding them, but probiotics, prebiotics, pre would mean food for the bacteria and probiotics means actual bacteria. These have been shown in multiple studies to help in metabolic syndrome, in metabolic health, and of course in gut health, in diarrhea. So use them as per requirement and be rational when you use them. The third thing would be our foods. The foods, you don't always have to give a pre or probiotic as a capsule. You can give it as a food. And we spoke about various fermented foods, the dhoklas and the pickles. But again, use them in moderation, especially if your patient has got electrolyte disturbance or severe azotemia. But let's try to conclude today's session. We spoke about 3 L's: lifestyle, language, and the lumen. And now we realize, all of us, speaking to Dr. Puneet, Dr. Shiv Shankar, Dr. Siddharth, that these are equally strong pillars. If we can focus on these, our dependence upon the pharmacological pillars may go down. Our impact on the patient and the community will certainly go up. The patient and the community will feel, yes, this is a doctor who understands me. The doctor is concerned about me, and the outcomes will improve. So, Dr. Sharma, again, before we conclude, and it's dinner time for all of us, your favorite fermented foods, can you allow us to eat anything tonight? We have normal potassium and normal creatinine, sir.
Sir, you can eat whatever you want, sir. And you are very welcome to Indore, and we can go to Sarafa together. Sarafa is now a little shrunken because the number of, now it's only the old shops. Gradually they are reducing the new shops. Sir, my personal favorite is dhokla. So I go ahead with dhokla whenever I crave for a fermented food. Other than that, Shrikhand and sometimes Imarti. So now my mouth is watering.
So for dhokla, we'll be dopaminergic. And for the Shrikhand, we'll be sattvic. We'll take a little bit. So little bit is allowed. You can take everything in moderation.
Yes, sir.
And Dr. Siddharth, question coming your way, and this is from Dr. Sushil Jindal, sir. What is your favorite fermented food?
सर श्रीखंड तो सर ने बोल ही दिया है, तो श्रीखंड comes first. Second, sir, curd rice, and especially curd rice which I have kept overnight in a relatively clean condition. That is very satisfactory for the gut and the brain.
Yes, true, and that's an all India favorite now. Curd rice across the country, people use it, and we actually, that's another nice thing of being Indian, of being living in India, is that we learn from each other. So much of diversity. Where else in the world could you get so many different types of foods and beverages? So Dr. Puneet is, we've lost him, but Dr. Puneet, Dr. Shiv, Dr. Siddharth, thank you so much for being with us. Today's 4D session, yes. Today's 4D session was on the 3 L's, the forgotten L's: lifestyle, language, and lumen. And our 3 experts have made this such a lively discussion, such a lovable discussion, a discussion full of laughter. On this note, I'd like to thank everyone for being with us. Dr. Shiv, thank you so much. Dr. Siddharth, thank you so much for being with us.
Thank you, sir. Good day, sir.
Good day. Jai Hind.
Jai Hind, sir.
Jai Hind, sir.